I am also going to be introducing our next video, which is from the Spondylitis Association of America. Like I mentioned, it is also Axial Spondyloarthritis Awareness Month, and this specific session is going to be about managing mental and emotional health. As we've talked about throughout this stream, not only is it the physical that we all deal with, but it's also the mental and the emotional that comes with it, with having these diseases. And so, I just wanted to preface that. There will be some great tips and tricks here on how to manage your mental and emotional health, having to do with grounding and mindfulness and everything like that. So, I'm going to go ahead and share this and make sure that everyone is caught up and that we can make sure that everybody can see this stream. So thank you to everybody who let me know that the stream was down. We got it back up, and hopefully we will be smooth sailing from here on out. Alrighty. Let's try that again. Share screen, share tab, share audio. Alrighty, here we go. I'm going to pause again because it's showing my whole screen instead of just showing the tab. So let me try again.
In our Spondylitis Association of America and UCB collaboration on healthy living with AXSPA. Hopefully you joined us last time when we talked about the benefits of an anti-inflammatory diet and did some cooking. And I am very thrilled tonight to be joined here by Dr. Jana Baldwin-Lomax. She is a licensed clinical and health psychologist and owner and clinical director of Shift Healing and Health Psychology. I'm Dr. Hillary Norton. I am the medical director of Inspire Santa Fe Medical Group, and I'm a rheumatologist in practice who focuses on spondyloarthritis. So let's talk a little bit about just quickly what is spondyloarthritis. This is a group of diseases that includes non-radiographic axial spondyloarthritis, ankylosing spondylitis, reactive arthritis, and others. And this really is characterized by inflammation of the spine and the peripheral joints. It can include enthesitis, inflammation of the tendons and ligaments. And these diseases are really active at night. And so, right away, we're talking about sleep disruption. Whenever we're talking about an inflammatory disease, we know that that has an impact on mental and emotional health. And these patients are at increased risk of anxiety, depression, sleep disorders. And we know that, the less control that people feel like they have over their disease, the worse these things can be. So it's really important for us to acknowledge the whole person, the whole health. And that's where Dr. Lomax really comes in. And that's where we really want to partner with mental health experts in this space so that we can treat the whole person. So welcome, Dr. Lomax.
Thanks. I'm so happy to be here with you, and I'm so happy that you guys are recognizing the impact of a chronic illness such as these, and how they can certainly increase risk for emotional distress, and the long-term effects of stress on the body can have long-term effects on stress on the mind and social life.
Absolutely. And, I think not a week goes by in clinical practice where I don't get asked, did stress cause this disease or did stress cause this flare? Because I think that intuitively we know how much impact stress has on our immune systems. And we have great studies and data that show us that. But I think that unless we address the whole person and these aspects, we're not going to get the optimal outcomes.
Right, right. And as we know, there's no such thing as a stress-free life. There's no way to control, in many cases, the stress that's coming into our lives. It really is our life's journey to figure out how we respond to and perceive stress in our lives. So even if someone was experiencing a high stress time that they did not bring upon themselves, their response to that may show demonstrate resilience and incredible coping skills, but is still going to have some impact on how they experience, how their body experiences that stress. And so a lot of my work with people with chronic illness is to evaluate what they perceive as stressors and then what sort of tools they have in their toolkit to respond to those stressors. And often it is about adding more tools to the toolkit and not continually depending on some that maybe are no longer serving them or no longer working.
I love that. I think that's such an important point that it's how we respond to stress and what our coping mechanisms are. Because, like you said, we all have stress in life, but it's very empowering to think that we could have tools that allow us to respond better. Because if we're thinking about, well, I can't, eliminate stress, then that thought in itself can cause stress, right? But
Right,
to
right.
realize that, well, stress is going to be there, but we can actually respond in a different way. Again, I think that's very empowering.
And we also know that a certain amount of stress is actually beneficial for us. It
Mm.
helps us perform better, it helps us focus, it helps us actually activate. If we don't have enough things that challenge us in our lives, we become complacent or aren't really able to engage fully. So I talk with my patients about this bell curve as it pertains to anxiety or stress in their performance. And we want to be somewhere in the middle. A certain amount of stress really helps us optimally function in life. We don't want to be without any, and we don't want to be paralyzed by stress. We want to be in the middle.
What a great concept that a certain amount of stress is healthy. I love that. And, that really reminded me of another concept that we think about a lot when we're treating chronic pain, and that is our response to pain, right? Because we can let that consume us, we can let it be a negative thing, or we can put a little bit of space between us and the sensation of pain. And, then I'm getting a little bit into the concept of mindfulness based stress reduction, but, we can choose how we respond to all of these different things in life. And so I think that your field is so fascinating because it just gives us these tools to respond differently.
Yes, yes. And yeah, we certainly can talk about creating that space, or how do we respond to that stimuli in our body that's telling us something. And so often, I think historically in mental health and even in medicine, we're trying to damp down or suppress that message to us. But I'm working with my clients to try to get curious about what that message is trying to tell us, and recognizing that if we don't get so married to what that means, then we may notice that that message may flow more freely. And so pain may fluctuate in terms of how you experience it if you're willing to get curious about it, rather than catastrophizing and immediately, maybe having a joint pain and jumping to, oh my gosh, this is going to be a flare and it's going to impact my vacation next week. And being able to say, I'm going to pause, breathe into this, or get curious about it, maybe take 10 minutes break from evaluating what it feels like in the moment and see if it shifts at all. And so starting to get in relationship with how our body and mind responds to stimuli, rather than feeling like we have to completely shut it down or distract ourselves from it, because often those messages, both emotionally and physically, are trying to tell us something, but we sometimes misinterpret what they're trying to tell us.
Oh, that's so good. That's so good. When I was in training in medical school, we were taught that the neurosystem was different than the immune system, was different than the endocrine system. And then there's this fascinating field of psychoneuroimmunology. And we know that all of this is connected, which
Of
of course
course.
it's all connected. Um, so
Yes.
I'm hoping that you can give us some tips and tools about how you just tell people, how do you help them? What can we do that's really practical?
Well, one of the ways I like to back up and talk with patients about, how do they start to know that they are tipping into that red zone of stress? What are their, because everyone's different, and I bristle at these, kind of one size fits all coping mechanisms. Well, you should
Mm,
journal, or even mindfulness. That those things don't always work for everybody. And so
yeah.
we kind of peel back the layers and say, what tend to be your social responses when you're stressed? Are you short with people? Do you isolate? Do you seek out support when you're stressed? So, looking at multidimensional ways of responding to stress, social, cognitive, somatic, emotional, and then recognizing that those are all different ways that we respond to stress, and people can start to learn their barometer for what are the first indicators that they're moving
Mm,
into that red zone. So some people think, oh, I need to have a glass of wine. Well, let's pause there and see what it is. What's going on in my system that's leading me to think I need that? Or I just lost it on my coworker. I should pause and see what's going on here. So that's one of the first tools that we unpack, is what are the ways that I can start to know if I'm tipping into that place of dysfunctional response?
that's so good because it's so hard to recognize a flare, physical flare sometimes, right? And people have a hard time, even after living with the disease for many years, knowing what's actually a flare and what's not. But since stress is the most common reason that I see for flares happening, if you can get those first clues, that's great. Those are really empowering tools.
And if you feel empowered, I love that you use that term, to be able to pause and say, maybe I need to make a shift in what I'm doing right now, because I'm starting to notice that this is coming up for me. And that tends to be the hardest piece, because we are often moving on a hamster wheel, and we're often, going through the motions of so many things, that if we have to pause and either tell somebody, you know what, I know I committed to volunteering this weekend or doing this, and I'm going to have to say no. So it really is about honoring our values to ourselves and being able to set boundaries, recognizing that if I say no to that activity now, I'm going to have more bandwidth to really show up in a month from now when I'm volunteering again, for example. And so I, teaching people about assertiveness and the importance of being clear about what's important to them, and that what's important to them is really how that needs to be their guiding post.
Oh, that's so good for everybody. I mean,
Yeah.
especially if you're living with a chronic disease, which adds a whole different layer to everything. But really, for all of us, it's sort of that idea that you have to take care of yourself before you can take care of anybody else in life, right?
Yes, yes. And so frequently we default to old patterns of coping without recognition that we've evolved and grown over time, that maybe some of our old tools no longer serve us. And for some reason, I don't know what it is in our society that we feel so, identified with certain things are so me, but we get to change and you get to say, that group of people maybe doesn't serve me, or that music used to be a stress reliever for me and no longer is. And to really give ourselves license to evolve. I mean, what are we doing here? What are we learning if we're not evolving? And so many people get really tied to identifying it's a certain way. And I really invite people to explore what it means to grow and to change and to evolve and to surround themselves with people who are also interested in really changing, really
Oh
evolving.
boy, that just really speaks to me. I love that. As somebody who thrives on change, I just love that concept of,
Yes.
finding out what works for you now. And maybe that's different than 5 years ago or even 3 months ago. That's
Yeah.
fantastic.
Yes, and I think often with chronic illness, there's so much loss that people experience, loss of sense of health, loss of sense of control of their, self or their schedule, and they often get kind of stuck in that place of focusing on what they've lost. And I really want to honor that there's an important place
Mm,
for that grief, and that
yeah.
does deserve, and we can create some energy around what it's like to have lost things. But often we gain wisdom as well. We get to choose what amount of our pie graph of life the arthritis gets to live in. It doesn't go away, but where does, and recognizing that with a flare it's going to take up a much larger slice of the pie, but making sure that those other slices of the pie that bring resilience, that further, grow who you are as a dynamic person, also get a lot of energy, because often people are so frustrated around their condition that it gets so much more of the pie than it actually needs.
Oh, that's a really good point. I've talked before about even at times thanking the disease as a patient because it causes you to go to that deeper level. Everything that you're talking about right now, the disease can be that thing that prompts you to go there and to do that work. And that's a gift to do that work.
That's exactly right. I mean, you can still be, for the remainder of your life, angry that you got this diagnosis and that it didn't, you don't need to, most people didn't need this lesson, or this wasn't the only way they were going to learn it. This whole everything happens for a reason is a real frustrating idea to me, not something that I ascribe to, but they get back into the driver's seat. So yes, it can be a gift because they found resilience they didn't have before, or they really rededicated to things that are important to them, or they got clear on what was important to them, because it might have been they were living a life for things that were important to other people. And that's, I mean, specializing in this area for the past 20 plus years, I'm working with most people who are seeking mental health for the first time because they were diagnosed with some sort of life altering condition. And it can be a gift, but it can be a gift that you can still feel frustrated about, but getting
Sure.
empowered, getting back in the driver's seat about what you want to take from that event, from that diagnosis. And this is true for most of us who experience some level of trauma or loss or something we didn't choose in our lives. We learn to adapt and evolve and bring those wounds with us as signs of power, as our superpower.
Oh, yeah, I love that as our superpower. That's really good. So, can you share with us some of those strategies that you share with patients for approaching this?
Yes, yes. So, I mean, I do. deeply believe in a gratitude practice as a regular tool for, I mean, and we know the science is there. Robert Amons is one of my favorite researchers. He's written a number of books on gratitude as a health practice. And we know that it can actually reduce depression and anxiety risk, and it
Mhm.
can improve social engagement and social interaction. It also helps people not feel so isolated. If we feel
Yes.
grateful to the universe and grateful to the people in our lives, maybe it's the barista at Starbucks who made the best coffee, if we can really recognize that our wellness comes in community, then gratitude is a great practice for
It
balancing
is.
out the
Yeah.
things in life that also feel frustrating and don't feel in our control.
I was even reading recently that gratitude practices actually change our brains, that
Yeah,
it physically changes our brain when we practice gratitude on a regular basis. That's amazing.
that's right. And I think it's a kind of a lower hanging fruit, if you will, than what people perceive as mindfulness or meditation. And there's such a wide gamut with meditation that I try to try to let people know my personal approach with meditation, I've been practicing for a long time, is a guided meditation to listen to someone else's voice. Because if I'm left alone with my own thoughts, despite all of my efforts, I still end up wandering down a path that I didn't want to go. And so,
Yes, yes.
helping people to either use Insight Timer or Calm or some of those apps that are out there, and most of them are free. I don't think people need to pay for guided imagery. There's lots out there, Spotify and plenty of places, but find things that resonate with you. And maybe it's not about managing pain. Maybe it's about gratitude. Maybe it's about loss. Maybe it's about, connecting with your higher power. And what people who are of, spiritual or religious practice may not recognize is that prayer is a form of meditation as well. And so they may be
Absolutely
more
is.
practiced in that than they recognize. But I like to have
Absolutely.
a go-to place for, I have just when I need it, I have a place in my mind that really grounds me and I can get there in just a second. And I encourage people to have a safe or relaxing place that they practice regularly so it's very accessible if they're pulling up to the doctor's office, to ground themselves right as they walk in.
Oh, that's a really great tip. I love that. And I'm a big fan also of the guided apps. I have discovered that those sleep meditations are much more powerful than you would think. I mean, those are really helpful.
Sleep meditations are amazing. And yeah, if you fall asleep, that means it's working. A lot of people are like, I
Exactly.
fall asleep listening to meditations. Like, that's deep relaxation.
The idea.
Here's success. That's
That's
right.
the idea.
Yeah.
Exactly.
I mean,
Exactly.
the other tools that I, recommend to people is making sure that they're getting outside and communing with nature in some
Ah,
way, shape, or form. We
yes,
spend way too much time inside on technology with a screen in front of our face. We also know that that puts us at risk for emotional distress. And so I highly recommend that people, even if they're having a really big flare day, is to get near a window, open that window, or just get outside and sit and notice their
yes,
environment. Get outside of their body, get outside of their head, and
yes.
notice what's happening around them.
Forest bathing. So
Yeah.
I talk to my patients about forest bathing. There was an incredible study that I learned about. So it's called Shinrin Yoku in Japanese. And they took two groups of people and they had one group walk in nature. They had the other group walk in an urban setting, and not walk as in get your heart rate up, get your exercise in, but just, just wander. And
Mhm.
beforehand, they drew their blood, they checked their immune cells, their natural killer T cells, then they checked it afterwards. And the group that wandered in the forest had a better immune system, a stronger immune system. And it lasted for weeks. They checked them again. And so I think that, that study was just about appreciating nature, about noticing that tree, about noticing the color of it, the texture of it, just noticing our surroundings. And I often recommend to people who are struggling with fatigue to get outside in nature at least once a day because studies have shown that it really does help with fatigue.
Yes, yes. I'm so glad that you have that as part of your recommendations, and I love the forest bathing idea. That's awesome.
It's, and it's
I'm
such a fun concept, right? Bathing in the forest. And we can do that anywhere, like you said. It can just be stepping outside of your house or your office or wherever you are and just appreciating nature for a minute. It really helps.
I mean, it's hugely impactful. And I think people would assume as a psychologist that I, espouse therapy. And yes, talk therapy, we know there are many opportunities and benefits and interventions, but there are lower hanging fruit than that, which is, a gratitude practice or getting outside and also engaging in community in some way. That's the other piece is I assess, who are you surrounding yourself with? What do you feel
Mm.
engaged in? And I know that's really hard for people. They tend, if their illness has tremendously impacted their functional status, they can really feel disconnected from their previous social life. And so finding ways to re-engage in community, maybe that's not the same community that you used to be engaged with. And although finding support through a spondyloarthritis support group is a nice part of gaining community, I would also recommend people do something that is not related to their health or wellness, that is related to something they care about. Is it a book club? Is it, knitting? Is it just some level or some kind of community that helps you grow another part of your identity that may have been lost by virtue of the illness? So that's a really big focus too.
Yeah, no, I think that we have a lot of studies that tell us the benefits of socialization. And, when we have a chronic disease, if you're struggling with pain, it can be easy to isolate. So that's a really good reminder.
And often people think they need to make excuses for their limitations in comparison to their previous self. But if they're
Mhm.
developing a new chapter of their lives with this illness, they get to walk in and be whatever version of themselves that they are now. And so if they're volunteering at a pet shelter or something, they don't have to make excuses. Those people didn't know their previous version of themselves.
Mm.
I really like this idea of recognizing that it's about your relationship to yourself and not feeling like you're an excuse, but you get to be as full a version of you that you can be with this new illness, this new chapter that you're
Oh,
in.
that is a great, great concept. It's who we are today, right? Right now.
Right, right, that's right. And I mean, as we go through life, we experience a lot of loss, a lot of trauma, a lot of change. There's nobody out there that is unscathed. But I think when you're in an illness, it can be so isolating and it can be so,
Mm.
um, there's so much loneliness, which we know increases risk for depression and anxiety. So it really is about finding ways of connecting. We are social beings at our core, and we know for our overall wellness, being part of something with community is really essential for wellness and mental health.
Absolutely. Very good tips. Very good tips.
Yeah.
And I know that you recommend exercise.
Oh,
You talk about hobbies and interests, and that can all tie in together, right?
oh, absolutely. Yes.
Yeah.
Movement in whatever way one can. And I think, again, it is about loving this chapter of your life, finding ways to feel grateful, finding ways to focus on what is working, even if there is loss that you're
Mm.
no longer able to maybe run, but you can walk and do mindful walking, recognizing that in there we can't completely dismiss that there's loss and there's sadness, but how do we grow what we feel grateful for? How do we grow a new, new recognition of the resilience that we're building in the face of adversity?
Yeah, I mean, that resilience concept keeps coming up because it's so important for our healthy immune system, our resilient reaction to life stressors and to
Yeah.
life in general.
Yeah, I've had patients tell me, "I'm tired of being resilient." And I said, "Well, then that's time to take intentional rest." So I think a lot of people feel forced to rest by their illness, but if you're intentional and you say, "I'm gonna spend this time really disconnecting, not gonna be scrolling on social media, not gonna be," but really intentional rest in whatever way, shape, or form, that can be so much more fulfilling than feeling forced to have to check out of life. So shifting
Mhm.
your mindset around taking some time and that rest can really be a tool for building resilience is so important. But our society as a whole also needs to recognize that.
We need to get better at rest. I
Yeah.
agree. I mean, I think that we don't prioritize that. And for our health in general, all of us could use to shut off the screens and to just have some downtime that's really good for us. So yeah, really, really great tips.
Great.
Um,
Yeah.
and then I know that you had said that breathing is something that I'm recommend. I'm really curious about this because I've talked to other practitioners, even a physical therapist that I work with. He recommends taking that time out. And if you wear a smartwatch and, they have apps where you can just take a minute and breathe. And, for people who are go, go, go all the time, stopping and just anchoring with the breath can be really helpful.
Yes, and we know people who experience trauma and also people who experience pain feel disconnected from their body. And
Mm.
sometimes that's a coping strategy, but what we don't know is that sometimes we're not recognizing some of those cues. So breathing can be a great way to reconnect, become more embodied, get back into one's body. And there are so many different breathing techniques that have different outcomes. But one of the breathing techniques that I like that has been studied for lowering, heart rate and blood pressure is the 4-7-8 breath, where you inhale for 4, hold for 7, and that's not 7 whole seconds, it's whatever your count, and then exhale very slowly. But we do know that that can really slow things down. The square breath is another one that people do. They sort of visualize a square of inhale and exhale and holding the breath in between. But really, it's just about reconnecting with one's body, and noticing without judgment what's happening in one's body. And then I like to encourage people to radiate gratitude toward all parts of their body because they're trying to achieve homeostasis. Our bodies are trying to achieve balance. And so if we can radiate gratitude toward that, then there is less battle happening internally.
Oh yeah, and just increasing the parasympathetic nervous system because we're in fight or flight mode so much of the time. And then if you sort of feel like you're doing battle with your own body due to pain and other symptoms, I think that increases that sense of fight or flight. And
So,
to calm that has a huge impact on our physiology. And
yeah.
it's free. Our breath is just, it's there. We have to do it.
Right.
It's a free tool to us. So I need that reminder too, but to just come back to our breath throughout the day is very powerful.
Yep, yep. There are types of therapy called somatic experiencing or somatic based therapies, which I would recommend if people are pursuing that they find a licensed and experienced practitioner, but
Yeah.
that can really help people learn a bit more about how to connect with their body, particularly people who've been through traumas or their bodies have been through traumas to reconnect with different parts of their body that may have been disconnected as a coping mechanism, but remain disconnected and that is no longer serving them. So that's one of the therapies. And then, other interventions are acceptance and commitment therapy, EMDR, cognitive behavioral therapies. Those we all know can be nice tools for people that may have a lower emotional intelligence or less practice connecting with how their thoughts, their behaviors, and their emotions interact with one another. So
Yeah,
just
I mean, I think that the basic message is if you're interested in these things, definitely find a licensed practitioner who is an expert in this, who can help guide you. It's so inspiring to hear about all these different ways that we can really better our emotional and mental health because it's such an important part of our health in general. So I'm inspired to do a better job focusing on all of this. And I hope that everybody else who has heard this is inspired as well.
yeah.
It's been a pleasure talking to you about all of this. I think your patients are very fortunate to have you to help them along this journey.
Yeah,
So,
ditto.
yes.
Yeah. Thanks so much. And I'm so glad that you ask these questions and pursue these things with your patients because your patients are also very fortunate to have someone that is thinking about their whole system when thinking about their wellness.
Well, we have incredible medications in this space, but I often tell people that unless we address the rest of their health, we're just not going to get the optimal outcome. So I think we're all striving for optimal health, and this has been a really inspiring conversation. Thank you so much for joining me and talking to me. And I would like to thank UCB for sponsoring this SAA video, the second part in our Healthy Living with AxSpa series. Thank you so much, everyone, for joining us.
Yes, thank you.
Hey, everybody. So, thank you so much to the Spondylitis Association of America for giving us that really informative video on managing mental and emotional health.